Do you ever feel unmotivated to pursue your goals? Have you ever found it difficult to get out of bed in the morning because you just don't want to face the day? Does your life ever feel bleak and without meaning? If you've answered yes to any of these questions, you may be suffering from a depressive disorder and not realize it. I'm Dr. Donna, Leigh, Bliss. I have over 30 years of experience as a clinical social worker. I've worked with many clients who've had problems with depressive disorders, so I understand how difficult they can be to cope with. I also know that there's lots of treatment options that are available that can help you to feel better. So join me as we learn more about depressive disorders, take a look at what research shows us about the causes of depression, but most importantly about treatment options that are available to help you feel better about your life. Now is always the time to start making positive changes in your life. While occasional feelings of depression are a normal part of life, as people can feel sad or hopeless at times, especially during times of high stress or loss, depressive disorders involve more than just temporary feelings of sadness or hopelessness that don't go away, but can actually get worse over time and interfere with daily activities such as work, school, and relationships. Depression affects almost 1 in 10 Americans. According to a recent article in the U.S. News and World Report, between 2015 and 20, the incidence of depression reached 9% amongst Americans 12 and older. Among teens and young adults, the depression rate stood at 17% in 2020. Data from the National Health Interview Survey in 2019 shows that 2.8% of adults experienced severe symptoms of depression, 4.2% experienced moderate symptoms, and 11.5% experienced mild symptoms in the past 2 weeks. The percentage of adults who experienced any symptom of depression was highest amongst those aged 18 to 29, followed by those aged 45 and older. Women were more likely than men to experience mild, moderate, or severe symptoms of depression. Among the more common symptoms of depression are a persistent sad, anxious, or empty mood, feelings of hopelessness or pessimism, feelings of irritability, frustration, or restlessness, feelings of guilt, worthlessness, or helplessness, and the loss of interest or pleasure in hobbies or activities, including having decreased energy and fatigue. Depression is not a one-size-fits-all disorder, as it can greatly vary based on intensity, duration, and the cycle of high and low ups and downs. According to the Harvard Medical School, there are 6 common depression types. Major depression, also called clinical depression, involves an all-consuming dark mood where one loses interest in activities, even activities that are usually pleasurable. Common symptoms include trouble sleeping, changes in appetite or weight, loss of energy, and feeling worthless. Thoughts of death or suicide may occur. Overall, between 20% and 25% of adults may suffer from an episode of major disorder at some point during their lifetime. Persistent depressive disorder, formerly called dysthymia, involves having a low mood that has lasted for at least 2 years, but might not reach the intensity of major depression. Many people with this type of depression are able to function on a day-to-day basis, but feel low or joyless most of the time. Common symptoms include changes in appetite and sleep, low energy, low self-esteem, or hopelessness. Bipolar disorder involves having episodes of depression, but also going through periods of unusually high energy or activity. These manic symptoms appear as the opposite of depression symptoms and include grandiose ideas, unrealistically high self-esteem, decreased need for sleep, thoughts and activity at higher speeds, and ramped up pursuit of pleasure. Being manic can feel great, but it doesn't last long and can lead to self-destructive behavior and is usually followed by a period of depression. Seasonal affective disorder is characterized by recurrent episodes of depression in late fall and winter, alternating with periods of normal mood the rest of the year. Symptoms usually begin in October or November and subside in March or April. Some people begin to experience a slump as early as August, while others remain well until January. Regardless of the time of onset, most people don't feel fully back to normal until early May. Perinatal depression is a type of depression that women can experience. It can include major and minor depressive episodes that occur during pregnancy or in the first 12 months after delivery. Up to 6% of women will experience a major depressive episode during pregnancy or in the first year following delivery. Any woman can experience postpartum depression, and it has no relationship to a woman's capacity to be a good mother. And finally, PMDD is a severe form of premenstrual syndrome and includes symptoms that usually begin shortly after ovulation and end once menstruation starts. Research has identified several possible causes of depression. They can range from biological to circumstantial. Brain chemistry is a common possible cause. There may be chemical imbalances in parts of the brain that manage mood, thoughts, sleep, appetite, and behavior in people who have depression. Previously, it was suggested that for some people, having too little of certain substances in the brain, called neurotransmitters, could contribute to the onset or worsening of depression. According to this idea, restoring the balance of brain chemicals could help alleviate symptoms. This is where the different classes of antidepressant medications may come in. Many antidepressants alter levels of certain neurotransmitters in the brain. However, the belief that depression is caused by chemical imbalances has been declining in the scientific and medical community for some time. Still, the belief that chemical imbalances are responsible for causing depression is widely held by the American public. One survey found that nearly 85% of respondents believed that such imbalances were the likely cause of depression. Hormone levels are another possible cause. Changes in female hormones, estrogen and progesterone, during different periods of time, like during the menstrual cycle, postpartum period, perimenopause, or menopause, may all raise a person's risk of depression. Family history. You're at a higher risk for developing depression if you have a family history of depression or another mood disorder. Early childhood trauma. Some events affect the way your body reacts to fear and stressful situations. Another cause is brain structure. There's a greater risk for depression in the frontal lobes of your brain if they're less active. However, scientists don't know if this happens before or after the onset of depressive symptoms. Medical conditions. Certain conditions may put you at higher risk, such as chronic illness, insomnia, chronic pain, stroke, heart attack, and cancer. Substance abuse is another cause. A history of substance or alcohol misuse can affect your risk for depression. And finally, pain. People who feel emotional or chronic physical pain for long periods of time are significantly more likely to develop depression. So it's more likely than not that depression is not caused by any one factor, but by a combination of various factors. Despite how uncomfortable depressive disorders can be, the good news is that they are treatable using psychotherapy, medications, and general measures such as relaxation techniques and improved self-care. I've worked with many clients on improving their level of self-care, and it's fascinating to me how common it is for the depressive symptoms to start to improve as they start taking better care of themselves. Psychotherapy involves working with a therapist to reduce depressive symptoms. Cognitive behavioral therapy is an evidence-based approach that works on identifying negative thought patterns such as self-doubt and feelings of guilt that can make the problem worse. The aim of CBT is to identify and then modify these false and distressing thought patterns so that a person feels better about themselves and their circumstances. This frequently leads to improvements in mood. Interpersonal therapy is most often used to treat depression, but can be recommended with other mental health conditions. This approach focuses on the relationships a person has with others, with the goal of improving the person's interpersonal skills. In this form of psychotherapy, the therapist helps people evaluate their social interactions and recognize negative patterns like social isolation or aggression, and ultimately helps them learn strategies for understanding and interacting positively with others. Medications are frequently prescribed to help treat depressive disorders. According to the Mayo Clinic, there are many types of antidepressants that are used to help relieve depressive symptoms, so it's best to talk with your doctor about the pros and cons of each to decide which one is best for you. Doctors often start by prescribing a selective serotonin reuptake inhibitor, also referred to as SSRI, as these drugs are considered safer and generally cause fewer bothersome side effects than other types of antidepressants. Common SSRIs include Celexa, Lexapro, Prozac, Paxil, and Zoloft. If a family member has responded well to an antidepressant, it may be the one that could help you. Or you may need to try several medications or a combination of medications before you find one that works. This requires patience, as some medications need several weeks or longer to take full effect and for the side effects to ease as your body adjusts. Oftentimes when I'm doing assessments on new clients, when I find someone that I think is suffering from a depressive disorder, I bring up the idea that it may be helpful for them to do a medication consult to see if antidepressant medications would be helpful for them. It's always interesting to me how many people say no, that they don't want to take antidepressants, but they really can't explain why. In my experience, I have found that they may have been on an antidepressant and had side effects that were not pleasant, or that they don't have a workable relationship with a provider, so they don't get a chance to talk to somebody to get their medications adjusted or get feedback that the side effects will get better over time. So one of the focuses I have in my work with clients is to encourage them to get accurate information so that they can make the best mental health decision for them. I don't advocate that clients take medication or not take medication, but I have found with countless clients that when I encourage them to talk with a doctor to learn more about the pros and cons of antidepressants, the benefits that they could receive from it, that this can help them make a good decision for their mental health. And it's always interesting to me how often clients then try using antidepressants and report back, usually after 4 to 6 weeks, feeling much better. So if you're thinking about taking antidepressants, or you've taken them before and you don't want to take them again, I encourage you to talk to a mental health provider about your concerns. It's important to get accurate information so that you can make the best decision for your mental health. I hope you found this video to be informative and inspiring. I encourage you to take action today to reach out to a mental health provider so that you can get the help you need. You don't have to suffer alone. In the description below, I've included links to other resources that you might find helpful. I've also included a link to my website where you can learn more about me and other resources I provide to help you to feel better about your life. Remember, now is always the time to take action to feel better about yourself.